And now it's time to move into rheumatology section where we got two doctors, Dr. P and Dr. PH, also known as Dr. Peter and Dr. Peter Henderson. And I don't know why Dr. P punches Dr. PH. Bam! So that's really the mnemonic for today, and that is dry eyes, rash, photosensitivity, hair loss, and dry mouth. Then we're going to see about the Raynaud's phenomena, psoriasis, back pain, arthralgia, arthritis, and then myalgia. And that's really going to cover whole of the rheumatology. So let's dive into the scene. Now, as I said, Dr. P punches Dr. PH. Bam! And that's our scene. Now, to add more to the scene, we add some more doctors and they are just going for the tug of war. Now, just like you can see, they are absolutely unequally divided. Are you really sure you're going to take them all out? That's really a one-man army. And I think that's the reason our Dr. P punched our Dr. PH. That's an absolutely cheating. Before we start, wait. How are you going to start if you don't even make the creases? What kind of game is that without marking and creases? So let's chalk out some creases onto the ground to tell you about the starting and the ending points. Now, if you really try to focus on this tug of war, you're going to find that we have only one doctor on the left side. Now, this one doctor is going to represent the involvement of only one joint, which is just monoarticular joint. While on the right hand side, you're going to see many doctors pulling the rope. Now, these many doctors are going to represent many joints, which is just polyarticular disease. So, in the context of joint pain, you can really tell if there's one joint involved or more than one. If there's one joint involved, that's because of tuberculous arthritis, septic arthritis, or just gouty arthritis. However, if there are more than one joint involved, that is because of rheumatoid arthritis or just connective tissue disorders or rheumatic fever. Also, sometimes you can get more than one joints involved in seronegative arthritis. And just like that, you'll see that the one doctor on the left-hand side is just close to the starting line. I mean, he's proximal. While on the right-hand side, you're going to see the bunch of doctors and they're far away from the starting line. I mean, they're distal. So if the proximal interphalangeal joint is involved, that is because of rheumatoid arthritis or just connective tissue disorder. However, if the distal interphalangeal joints are involved, that is in psoriatic arthritis. The same way, you can also ask about involvement of spine, hips, knees, and these are seen in osteoarthritis or just tuberculous arthritis. If the sacroiliac joints are involved, that's because of ankylosing spondylitis or seronegative arthritis. And just like that, if there's first metatarsopharyngeal joint involved, that is seen in gouty arthritis. Now let's start. 3, 2, wait, what? There is someone who is having some issue. And that's a tiny doctor. You see that tiny doctor? And he is just pointing towards the big doctor? Well, that's because of the pattern of joint involvement. If the small joints are involved, that is seen in rheumatoid arthritis or just collagen diseases. Sometimes it's also seen in seronegative arthritis. However, if the large joints are involved, that is seen in osteoarthritis, rheumatic fever, or just septic arthritis. And besides that, large joints are also seen in tuberculous arthritis. Now, when you have this big doctor on your side, I don't think it's cheating. I think it's a totally fair play. Anyway, let's draw a cave. Cave? What? Is that really a cave? Wait, no. I think it's an operation theater, also known as OT. And I really don't understand who made this OT. I mean, just look at the design. That's totally unique. Now, what we see here. We see a doctor or a surgeon that is coming out of the OT with a patient. Now, that the fun fact about the operation was there was a male doctor alone with a female patient in the operation theater, and that was a secret operation no one knew about. Anyway, and how do I know about that? Well, good question. That's because rest of the whole staff is just sitting outside that operation theater. So if we keep jokes aside and we see that doctor, he's just migrating that patient out of OT1 to OT2. So this is going to represent the character of joint involvement that is migratory. If there is migratory involvement of joint, that's seen in rheumatic fever. And if you see those two surgeons sitting outside the OT in the green suit, well, they look quite symmetrical to me. So that's the symmetrical joint involvement, which is seen in rheumatoid arthritis, connective tissue disorders, and ankylosing spondylitis. Next to these two symmetrical sitting doctors is a boy in the blue and a girl in the green. Now, That's a kind of asymmetry. You know, boy and girl, blue and green, that's asymmetrical. So this Dr. Boy and the Dr. Girl are there to remind you of asymmetrical joint involvement, and this is seen in osteoarthritis, rheumatic fever, gonococcal arthritis, and enteropathic arthritis. One more thing about this young doctor in the blue is that he's madly in love with the girl, while on the other hand, the girl has absolutely no interest in him at all. So this young flirty boy, disrespecting the personal boundaries of the girl, forcefully touches her and makes a contact. And ooh, hearts everywhere. Now, these hearts are there to remind you of contact, but not just contact, it's the sexual contact. So, when you see a patient with a joint pain, must ask about the sexual contact because that's seen in gonococcal arthritis or just Retter's syndrome, which is just can't see, can't be, and can't climb a tree. Next up, soon after touching that girl, this boy got discharged. I guess that was too quick. Disappointed but not surprised. You really need to work on that, boy. So that discharge, soon after touching that girl, is going to tell you about urethral discharge, and that is seen in gonococcal arthritis and again in Retter's disease. Next, we'd like to talk about the diurnal variation of the symptoms. And for that, we're going to draw a big moon and a big sun. Now, if the patient said that their joint pain is worse in the morning, which is just morning stiffness, so it means rheumatoid arthritis, collagen diseases, or just Bassett's disease, which is simply orogenital ulcers. On the other hand, if the patient say that their pain gets worse in the evening, that's seen in osteoarthritis, or if the pain gets worse at night, that is seen in tuberculous arthritis and gouty arthritis. Now, what next? We draw a man who is just sun moon bathing. Well, that man is there to tell you about photosensitivity. So, in a nutshell, if you see a patient with a joint pain, must ask about photosensitivity. That's because it's seen in various autoimmune diseases. And besides that man, what we got? Oh, a lady. And this lady is also taking sun moon bath. One more thing you'll realize is that her sun moon bathing didn't go just well. It just gave her rash. And guess what? This rash is just like nodules. So it's a nodular rash. So if you see a nodular rash and that is particularly painful on the shins, that's just erythema nodosum. And it's seen in rheumatic fever, and sometimes it's also seen in enteropathic arthritis and Bassett's syndrome. Now we draw a grave, and where there's a grave, there's a pangolin. And you can see right through that grave comes out a hand. And this hand is there to remind you of changes in the nails. So must keep Raynaud's phenomena or scleroderma in the back of your mind while you're taking history about the joint pains. And what about this pangolin? This pangolin is there to tell you about the scaly diseases. For example, psoriasis. If you encounter joint pain along with scaling eruptions on the extensor surfaces of the limbs, that's psoriatic arthritis. And what else we got? Oh, these are so beautiful butterflies. And these butterflies are pink in color along with the rash. And these rashy butterflies are there to tell you about the characteristic butterfly rash seen on the face in a patient with SLE. So if there's a patient with a joint pain, must try to see the butterfly rash on their cheeks. So until now, we have covered different dermatological associations with the joint pains. For example, the changing in nails, the scaly diseases, the butterfly rash on the face, the painful nodular lesions, specifically on the shin, and photosensitivity. That's enough of dermatological rheumatology, or whatever is it. Now, can we just take a little break from the associated symptoms and just talk about the progression of the disease? Well, to understand that progression, we draw these street lights. Now, as you can see, the first light is working, while the second light is not, and the third light is working again. So this is going to remind you of on and off attacks which are lasting for few days with the interval of freedom that is lasting for weeks. And this is seen in gouty arthritis. In simple words, if you see on and off attacks, keep gouty arthritis in the back of your mind. And one more thing, if they are just on and off episodes without deformities, that is seen in rheumatic fever, SLE, and enteropathic arthritis. Next, you'll see the second street light is deformed. So if there are remissions and exacerbation that ultimately lead to joint deformities, that's seen in rheumatoid arthritis and psoriatic arthritis. And after that deformed street light, you're going to see all of the street lights are working and they're just progressing so nicely till the end of the road. Now that means if there's a slow progressive course without remissions, that is seen in osteoarthritis and ankylosing spondylitis. Besides that all, if there's just one episode and you successfully treat it, that's septic arthritis or just tuberculous arthritis. Now, what else can we draw? We can draw a floppy heart balloon. And this floppy heart balloon is there to tell you about the heart failure. So, if there's arthritis that is followed by the symptoms of heart failure, for example, fluid overload, this is because of rheumatic heart. So, just keep it in the back of your mind. Now what? There's a circus show nearby? Let's go watch it. And whoa! To add some more spice, they added fire in the whole circus. Now, this fire is going to tell you about fever. So, if there's a joint pain in conjunction with fever, you're going to look for the rheumatoid arthritis, collagen diseases, rheumatic fever, or just septic arthritis. And now, just outside that circus, you see this man calling everyone for their attention through a megaphone. Oh, yes, that's a megaphone. So, this megaphone is going to tell you about the crackling sounds, just like that. So, what does that mean? So, that means if there's a patient complaining of cracking sounds in the joints while they walk, that is seen in osteoarthritis. So, to reinforce this crackling sounds with the joint pains, we have given this person an elastic bandage on the knees to tell you about the joint pains and the crackling sounds. Now it's time to really dive into the circus and look what we found: a stool, a red stool, or a bloody stool. Yes, this red stool is going to tell you about bloody diarrhea. So, if there's bloody diarrhea along with joint pains, that is seen in reactive arthritis or just enteropathic arthritis. And what's next? Over that stool is an acrobat who is just performing his act. And to make things more difficult, we just give him an eye mask or simply dry eyes. So, must ask about the dryness of eyes if you see a patient with a joint pain. And just to add more spice to the circus, we add another acrobat. And as you can see, this is a girl, but without hair. She actually had the hair loss. So must ask about the hair loss in the patient with joint pain. Also, you're going to see that she's arching her back. Well, that's there to remind you of the back pain. And just like the boy acrobat, to make things difficult for her as well, we're going to give her a mask. And now I think she is just a ninja. She is just covering her face. She's bald and she has some extra elasticity in the back. Now, these features are going to tell you about dryness in mouth, hair loss, and arching of the back or just back pain. Now, that's all really about rheumatology section. What do you say? Shall we revise these all symptoms again in a minute? Okay, so if you see a patient with a joint pain, don't forget asking about dry eyes, rash, photosensitivity, hair loss, dry mouth, Raynaud's phenomena, psoriasis, back pain, arthralgia, arthritis, myalgias. And if you talk about this joint pain, you must ask about the number of joints involved. Then you're going to ask about the affected joints, proximal, distal, girdles, whatever they are. Ask about the pattern of involvement. Ask about the character of involvement, diurnal variations, and of course, ask about the associated symptoms. For example, crackling sounds, fever, rash, bloody diarrhea, urethral discharge, redness of eyes, cramps, or just you can ask about the sexual history. That you're going to ask about the progression, if they're on and off attacks, or there are deformities or the features of heart failure, or it's slowly progressive, or if there's just only one episode. Well, all that depends upon the presenting complaint of patient. That's all about rheumatology section.